Brain tumors come in all shapes and sizes, and so do their symptoms. Still, some signs and symptoms are more common than others, like recurring headaches, communication issues, sickness, muscle weakness, and more. Today's video is all about warning signs for a brain tumor. Number 10. Recurring headaches. Headaches are a well-known symptom of brain tumors, although they may not always be the initial symptom. It is important to note that headaches can also be caused by other conditions, such as migraines, stress, lack of sleep, discontinuing certain medications, and changes in weather. However, persistent headaches can be an indicator of an underlying issue. Brain tumor patients tend to have a severe headache in the morning, which can worsen over time and become more frequent. These headaches may also intensify during physical activity, coughing, or changes in head position. Number 9. Seizures. A seizure is a sudden and abnormal surge of electrical activity in the brain that can cause a wide range of symptoms depending on the area of the brain affected. Some seizures may be barely noticeable, while others can be debilitating. Seizures are a common brain tumor symptom and can be classified into different types on where they originate in the brain, the person's level of awareness during the seizure, and whether or not the body moves during the event. Between 20 to 40% of brain tumor patients experience seizures, and an additional 20 to 45% may develop seizures during the course of the disease. If seizures worsen or occur more frequently, it may indicate that the tumor is becoming more aggressive. Number 8. Communication issues. The region of the brain responsible for processing both speech and vision is known as the language center. If a brain tumor affects this area, it can disrupt language function, resulting in several common symptoms. These may include language impairment, speech difficulties, memory loss, and a reduced ability to recall words and phrases. Other potential symptoms of language center dysfunction caused by a brain tumor may include difficulty describing objects, the inability to produce meaningful language, and difficulty understanding what others are saying. Emotional problems, such as depression, may also occur as a result of these communication difficulties. Number 7. Clumsiness and numbness. Brain tumors can cause various neurological symptoms, including mobility issues, difficulty with dexterity and balance, and problems with simple tasks like facial expressions and swallowing. Numbness and clumsiness may also occur, particularly if the tumor is located on the brain stem, where the spinal cord and brain meet. Number 6. Feeling sick. Nausea is a common symptom of many medical conditions, including brain tumors. Nausea associated with brain tumors can be more severe in the morning or when there is a sudden change in position from sitting to standing. If you experience nausea along with confusion or a feeling of sickness, it could be a sign of increased pressure within your skull, a condition known as raised intracranial pressure. Raised intracranial pressure can be caused by various factors, including the presence of a brain tumor. This happens when there is an increase of fluid or tissue within the skull, which can lead to compression and damage to the brain tissue. Number 5. Personality changes. Personality changes can be a symptom of brain tumors. The tumors can cause changes in the brain that affect a person's emotions, behavior, and cognitive function. In some cases, the emotional toll of having a brain tumor and dealing with the challenges may also contribute to personality changes. Common personality changes associated with brain tumors include aggression, irritability, confusion, depression, and mood swings. Some people with brain tumors may also experience a loss of inhibitions, which can lead to inappropriate behavior in public. Number 4. Focal deficit. Focal deficits are neurological symptoms that result from damage or dysfunction in a specific part of the nervous system, such as the brain, spinal cord, or peripheral nerves. These deficits can affect specific locations, such as the left side, right leg, or ear, and can result in a range of symptoms. Number 3. Muscle weakness. A brain tumor that pushes on or moves delicate tissues in the brain can lead to loss of strength or paralysis in various parts of the body. If you experience weakness or numbness in your arms, legs, or face, and it persists for more than a few minutes and is not due to sitting in an awkward position, seek medical attention. Number 2. Sleep problems. One of the most severe and common symptoms of a brain tumor is the lack of a good night's sleep. The decline in cognitive function and fatigue associated with the condition can contribute to difficulty falling or staying asleep. Additionally, brain inflammation may also play a role in interfering with sleep. Common symptoms may include trouble falling asleep, difficulty staying asleep, waking too early, and feeling unrefreshed or excessively fatigued during the day. Number 1. Hearing and vision problems. Sometimes brain tumors can cause hearing loss, impairment, or ringing, and the onset can be gradual or sudden. Growth of a brain tumor can cause vertigo, dizziness, and balance issues. In some cases, the pressure from the tumor can cause facial pain or weakness. If the tumor affects the area of the brain responsible for vision or the optic nerve, it can cause a range of vision problems, including blurred, double, or foggy vision. It may also lead to partial or total blindness and loss of peripheral vision. Let's talk about treatment. Number 5. Chemotherapy. Chemotherapy is the use of drugs to destroy tumor cells or stop it from growing. This type of treatment is typically given after surgery or radiation therapy, particularly if the tumor has come back. Common side effects of chemotherapy include nausea, vomiting, and hair loss. Number 4. Targeted therapy. In addition to standard chemotherapy, targeted therapy hits the tumor's specific genes, protein, or environment that allows the tumor's survival. This type of treatment blocks the growth and spread of tumor cells while limiting the damage to healthy cells. Not all tumors have the same targets, and some may have more than one. To find the most effective treatment, tests to identify the genes, proteins, and other factors are required. Number 3. Surgery. Surgery is often the primary treatment for brain tumors, especially if it's a low-grade tumor that can be completely removed without causing significant damage to brain tissue. However, if removing the entire tumor could cause harm to the surrounding brain tissue, the surgeon may opt to remove only part of the tumor to alleviate symptoms and improve the patient's quality of life. Partial removal can also provide a sample of tissue for diagnosis and determine further treatment. Number 2. Radiation therapy. Radiation therapy is a common treatment for brain tumors and uses high-energy beams to shrink and destroy tumors. External radiation delivers high-intensity beams to the site of the tumor, while internal therapy places the radiation source inside the body near the tumor. Side effects of radiation therapy may include fatigue, headaches, memory loss, and scalp irritation. Number 1. Radiosurgery. Radiosurgery is not a form of surgery in the traditional sense. Instead, it uses multiple beams of radiation to give a highly focused treatment to kill the tumor cells in a very small area. Each beam of radiation isn't particularly powerful, but the point where all the beams meet, at the brain tumor, receives a very large dose of radiation. There are different types of technology used in radiosurgery to treat brain tumors. Radiosurgery is typically done in one treatment, with most going home the same day. While these symptoms can help detect a brain tumor at an early stage, there are other warning signs you should be aware of. Watch 9 warning signs of colon cancer you should not ignore, or 16 warning signs of a magnesium deficiency. Go ahead and watch one or both videos to learn how to better read the signs your body is giving you. How do you keep your brain healthy? Let us know in the comment section below.